Hello everyone, welcome back to another lesson. This lesson is on the signs and symptoms of iron deficiency anemia. So anemia, which is a low hemoglobin level caused by low iron or iron deficiency. So a lot of these signs and symptoms can be applicable to anemia in general, but we're going to talk about some of the more specific ones that are associated with iron deficiency as well. So the first symptom, which is oftentimes one of the most important symptoms in anemia, is fatigue. So feeling very tired. And this is actually the most common symptom of iron deficiency anemia and anemia in general. And this is due to decreased oxygen delivery. So because there's a low hemoglobin level, hemoglobin is responsible for delivering oxygen to parts of our body. So fatigue, again, most common symptom due to decreased oxygen delivery. Now, another important symptom with regards to anemia is decreased concentration. So having difficulty thinking, concentrating, focusing can be a sign of anemia. And the decreased concentration could be due to decreased oxygen delivery again, and in general could be due to fatigue. So if you're very tired, it may be difficult to concentrate. Now, another symptom of specifically iron deficiency anemia is pica. Now, you might be wondering, what is pica? Now, pica is actually cravings for non-food items and objects. So examples include dirt, paper, etc. So where an individual may have these weird cravings for dirt and other non-food items, this is known as pica. And there's a more specific term we can use when the craving is for ice. So this is called pagophagia. And pagophagia can be found in iron deficiency anemia as well. So pagophagia is a craving and eating of ice. And pica in general is craving for non-food items like dirt, paper, and ice as well. Now, another sign, so this is a sign of iron deficiency anemia, is koilonychia. So koilonychia, you might be wondering, what is koilonychia? So it's actually something known as spooning of the nails. So if we take a look here, the nail has been curved in a way that resembles a spoon. So this is not normal curvature of nails. And the nails can often be brittle as well. And this finding can be more specific to iron deficiency anemia. Now, we can also see pallor, so a pale skin. So individuals who have lighter skin, this can be more noticeable. And oftentimes pallor is more noticeable when hemoglobin levels are less than 70 to 80 grams per liter. So very low hemoglobin levels can lead to pallor or pale skin. We can also see conjunctival pallor with anemia as well. So what is conjunctival pallor? Conjunctival pallor is when you get an individual to pull down on their eyelid and you look and it's quite pale. If you do it on a person who has normal hemoglobin levels, it's more pink and red. But in an individual with anemia, especially with a very low hemoglobin level, it is pale. It's light in color. And this is usually observed when hemoglobin is less than 80 grams per liter. Another symptom of anemia in general is weakness. Now, weakness is due to decreased oxygen delivery as well. So this can be tied in with fatigue. And we can also see presyncope and syncope with anemia. So presyncope is when an individual feels dizzy, where it's not where the room is spinning, but where the room feels like it's closing in and they feel faint. And if they actually were to faint, this is called syncope. So again, this is due to decreased blood and oxygen delivery to the brain. So if the brain doesn't get enough oxygen, doesn't get enough blood, they can feel very faint. They can have this feeling of dizziness. That is presyncope and syncope. Now, with anemia, we can also see dyspnea. So dyspnea is a shortness of breath. And again, this is due to decreased oxygen delivery. So their body is not getting enough oxygen delivered to the tissues. So this makes an individual feel dyspneic or short of breath. So that is the reason. Now, we can also see tachycardia. So tachycardia is an increased heart rate, oftentimes increased or higher than 100 beats per minute. And what's important here is that this tachycardia is at rest. So it's normal for an individual to have tachycardia if they're working out or exercising or doing some exertional activity. But at rest, this can be a problem. And in iron deficiency anemia, or anemia in general, we can see this, especially when there's very low hemoglobin levels. And it's because, again, there's decreased oxygen delivery. The body senses that and tries to compensate by increasing the heart rate to try to get as much oxygen to tissues as possible. And we can also see other irregular rhythms as well. And in anemia in general, we can see angina. And angina is chest pain. And this is often due to demand ischemia, or can be due to demand ischemia. So demand ischemia is where hemoglobin is so low, there can be very low oxygen delivery, even to the heart. So the heart can experience this and have ischemia or demand ischemia from it. So it can experience anginal chest pain. Some other important signs and symptoms of iron deficiency anemia include atrophic glossitis. So this is more specific to iron deficiency anemia. We can see this. So atrophic glossitis, inflammation, inflammation, gloss of the tongue. So inflammation of the tongue, and it's atrophic. And what that means is that when we look at an individual's tongue, this is a normal tongue here, and this is an atrophic glossitis tongue. And what that means is that it's a smooth tongue. So you can see here, there's a lot of contours and ridges here. But on this tongue, it is atrophic. It is smooth. That is a sign of iron deficiency anemia. We can also see angular cheilitis in iron deficiency anemia. So angular cheilitis and itis is inflammation. So it's an inflammation and cracking of the corners of the lips. That is angular cheilitis. So that is another sign of iron deficiency anemia. We can also see aphthous ulcers. So aphthous ulcers are little ulcers in the mouth. These are also known as oral ulcers. So again, ulcers in the mouth, they're white, gray in appearance with a erythematous ring around them, so reddened area, so very sore in the mouth. And interestingly, a syndrome that is associated with iron deficiency anemia in particular is restless leg syndrome. So restless leg syndrome, again, is associated with iron deficiency in general. And iron deficiency can worsen an underlying restless leg syndrome. So it's actually very interesting that if an individual has restless leg syndrome, it may be a symptom of iron deficiency anemia. So actually giving iron supplements can improve restless legs or restless leg syndrome. Now, some other signs and symptoms of iron deficiency anemia and anemia in general include cold extremities, so cold hands and cold feet. We can also see reduced appetite in these individuals, especially in children and adolescents, and this can lead to weight loss. Paresthesias are also another symptom of iron deficiency anemia. So paresthesias are tingling, burning, numbness types of sensations on the skin. And then another sign, a physical sign that may be found in patients with anemia includes splenomegaly. So splenomegaly is an enlarged spleen. And this may be associated with the reduced appetite. If the spleen has been enlarged so much, it could press on the stomach, leading to reduced appetite. But this is more due to extramedullary hematopoiesis. So this big word, means that there's blood making of blood in other parts of the body that don't necessarily always participate in making of blood. So extramedullary, it's outside of the bones. The bones are generally where blood is made. But some parts of your body, to try to compensate for low blood counts, they also activate to try to produce blood as well. So extramedullary hematopoiesis. And other types of anemia can also lead to an enlarged spleen for different reasons. Now, some other symptoms of anemia include anxiety. So anxiety is associated with anemia. We can also see depression being associated with anemia. This can be tied in together with fatigue and some of those other symptoms we talked about, like decreased concentration. Irritability is also another symptom of iron deficiency anemia. And then we can also see headache being a symptom of anemia as well. So again, a lot of different signs and symptoms. I talked about some of them that are more specific to iron deficiency anemia, like pica koilonychia, so the spooning of the nails, and also atrophic glossitis. But we can see there's a lot of other signs and symptoms that can be found in other types of anemia as well. So again, with regards to some of the other symptoms we see are anxiety, depression, irritability, and headache. And these can be more nonspecific. So I hope you found this lesson helpful and informative. If you did, please give it a thumbs up and consider subscribing to the channel. And if you want more information on other types of conditions and associated signs and symptoms, please check out my lessons on those topics. Thank you so much for watching, and I hope to see you next time.